I want to share some information with you today that I truly believe is going to blow your mind. It has to do with vitamin D deficiency and COVID infections. I want you to see what I pulled off of PubMed. Now, PubMed is actually a public government site, and it says vitamin D insufficiency may account for almost 9 of 10 COVID deaths. What do you think about that? And this is from their website. So I wanted you to actually see this before I dig in here. And this video is going to be very short to begin with. University of Chicago medicine researcher finds an association between vitamin deficiency and risk of infections. Now, this is a retrospective study, which basically means it's been done after the COVID crisis. So in a retrospective study of patients tested for COVID-19, researchers at the University of Chicago Medicine found an association between vitamin D deficiency and the likelihood of becoming infected with coronavirus. Now, PubMed talked about deaths. This is talking about infections. Now, vitamin D is important to the function of the immune system, and vitamin D supplements have previously been shown to lower the risk of viral respiratory tract infections, said Dr. David Metzer, Chief of Hospital Medicine at University of Chicago Medicine, and he is the lead author in this study. Our statistical analysis suggests this may be true for the COVID-19 infection. The research team looked at 489 patients at University of Chicago Medicine whose vitamin D levels had been measured within a year before being tested for COVID-19. Patients who had vitamin D deficiency, defined as less than 20 nanograms per milliliter of blood, that wasn't treated, were almost twice as likely to test positive for COVID-19 compared to patients who had sufficient vitamin D levels. So half of Americans are thought to be deficient in vitamin D, with much higher rates in the African American and Hispanic communities. So guys, this is no small thing. Now, the normal adult will use about 4,000 international units of vitamin D. So it would be safe to supplement about 4,000 international units if your vitamin levels are near normal. Some symptoms of vitamin D deficiency would include fatigue, not sleeping well, bone pain or aching, depression, feelings of sadness, hair loss, muscle weakness, loss of appetite, getting sick more easily, and having pale skin. So any of these symptoms, if any of these symptoms sound familiar, we do screen for vitamin D deficiency in our office. And then, of course, we also carry the vitamin D. I'll leave a link to the clinic pharmacy where you can buy pharmaceutical grade vitamin D, which is bioavailable. That means that your body can break it down and use it. It is pharmaceutical grade and it's checked by a third party. So really what I would say to you is, as cheap as it is to get vitamin D and as powerful as it is to resist infection, I believe everyone should be supplementing with vitamin D. In addition to that, get plenty of sunshine. But vitamin D is cheap and easy to get. Now, please do not think you can run down to Walmart and buy a quality product. You can't. And I don't mean to call them out in particular, but big box stores, drug stores, basically they sell very inexpensive vitamins that have a much bigger profit margin. So you want to pay maybe just a little bit more to get a quality product. But check the link below. If you have any questions, feel free to email me, call me. I'll be glad to talk with you. Thanks so much, guys. God bless you. Have a great day.
If you are struggling with a chronic condition and would like more information, feel free to visit www.birminghamfunctionalmedicine.com. You are also welcome to set up a phone or Zoom consultation with Dr. Daly at www.talktodrd.com.